Hello everyone. So let's start with the session of brachial plexus, a very important topic of upper limb. So many MCQs come from this topic, so we'll study in detail about the brachial plexus. Let's start with the discussion. So in this series, we are going with the brachial plex formation, the branches and also with the injuries, upper and lower trunk brachial plex injuries. So let's start. So here, if I talk about the formation of brachial plexus, so it's important to know exactly what do we mean by the word brachial plexus. Okay. So if I talk about the brachial plexus, it is formed by group or bunch of nerves. It is containing bunch of nerves, and these network of nerves are supplying the skin and the musculatures of the upper limb. So exactly the beginning point of brachial plexus, it starts in the root of the neck, and thereafter it traverses in the axilla, and the course of brachial plexus and all is covered by an axillary sheath, which is a continuation of prevertebral layer of deep cervical fascia. Also in this diagram, if you will see, if I enlarge this diagram, so you can very nicely appreciate the trunks of brachial plexus is traversing between the scalenus anterior and scalenus medius muscle. So thereafter, let's talk about. So exactly, I also want to tell that if we talk about the formation of brachial plexus, it is formed by the ventral rami of C5, C6, C7, C8 and T1. That means the cervical nerve and the first thoracic nerve, ventral rami. Now, it is also important to know this is the most common formation, but there can be at times variation. That type of brachial plexus are called as prefixed brachial plexus and the postfixed brachial plexus. So, we will talk about that. Before that, coming to this point, I just want you to show one image here. So, can you see here? So, in this image, you can see the roots of brachial plexus. So, what I told you, the formation of brachial plexus from the source or root is from the 5th cervical, the 6th cervical, the 7th, 8th and T1 thoracic spinal nerve. So, I have used the word ventral rami. So, I just want that you should be clear about the concept of anterior ventral rami and the dorsal posterior rami. So, what you can see in this image, let me slightly enlarge this image. So, when I am enlarging it, you can very nicely appreciate here. Okay, you can very nicely appreciate here, these are the gray matter. So, what is this butterfly shape inside? This is the gray matter of the spinal cord. So, this is G for gray matter and this is W for the white matter. So, from the gray matter which is containing the cell bodies, we have got two nerve roots. We have got dorsal and the ventral. The ventral nerve root is the motor one, and the dorsal nerve root containing dorsal root ganglia is sensory. It is the sensory part and this is the motor part. Now, these two parts will join to form the spinal nerve. That means it is very important for you to know that all the spinal nerves are of mixed variety. Why? Because they are containing both the motor and the sensory component. Thereafter, you can see these are dividing into ventral ramus and dorsal ramus. So, each spinal nerve, we have got 31 pairs of spinal nerves. Spinal nerves again divides into ventral ramus, which is going on to the anterior aspect of the body, dorsal ramus giving innervation to the muscles of back. So, this is the concept of ventral rami and dorsal rami. That means the exact formation of brachial plexus is from the ventral rami of C5, C6, C7, C8 and T1. Now, thereafter, let's come to again the discussion. So, if I talk about, so what I have told you is about the most common formation of brachial plexus, but other formation is prefixed and postfixed. So, if I talk about prefixed, so in case of prefixed, what happens? If I talk about brachial plexus, the common formation is via C5, C6, C7, C8 and T1. But if I am using the word prefix, so let me just highlight the word prefixed and let me highlight the word postfix. So, in prefix variety, the contribution is also taken from C4 and there is no contribution from T2. If I am talking about postfix type of brachial plexus, there in the formation of brachial plexus, the contribution of T2 is large and there is no contribution from C4. So, exactly, I just want to enlarge this image. So, when I am enlarging it, in this diagram, you can see the prefix brachial plexus is formed from taking contribution of C4 also along with C5, C6, C7, C8 and T1. So, these are the usual formation. What I have highlighted here is the usual. So, this is the usual formation of brachial plexus, ventral rami. But in addition to that, if contribution is also taken from C4, such kind of brachial plexus is called as prefixed brachial plexus. So, done with this. Now, let's talk about the postfixed one. Again, I would like to enlarge this image. So, when I am enlarging it, you can clearly see the postfixed brachial plexus. So, when I am talking about postfixed brachial plexus, what you can see, it is formed from the usual contribution of ventral rami of C5, C6, C7, C8 and T1, but along with it, it is also taking contribution from T2. So, it is also taking contribution from T2 spinal nerves. That means this kind of brachial plex form is the post-fixed type of brachial plexus. So, now we are clear with the concept of ventral rami. We are clear with the concept of formation of brachial plexus, and we are also cleared with the concept of prefixed and postfixed brachial plexus. Now, I would like to tell about the 5 major components of brachial plexus. So, one by one, we have to understand the concepts of brachial plexus formation. So, if I am talking about the brachial plex component, we have got 5 components. We have got the root which is formed by the ventral rami of C5, C6, C7, C8 and T1, which we have already discussed. Now, the trunk of brachial plexus are 3 in number. We have got upper, middle and the lower trunk. Thereafter, each trunk will divide into 2 divisions, anterior and posterior. The cords of brachial plexus are 3, medial, lateral and posterior. The branches from the cords, and why actually this point which is written here is supraclavicular and infraclavicular. Actually, what happens? The trunks and the roots of brachial plexus is lying above the level of clavicle. The location of division of brachial plexus are just behind the clavicle. But if I talk about the roots and the trunk of brachial plexus, it is residing in the neck region. So, they are called as supraclavicular part of brachial plexus. If I talk about cords and their branches, they are lying below the clavicle in the axillary region. So, they are called as infraclavicular part of brachial plexus. Now, this is a schematic diagram. Multiple colors has been used. Why? So that you can understand the formation of brachial plexus. The first, if I talk about formation of brachial plexus, just see here. So, here I will write roots for C5. So, C5, C6, C7, C8 and T1 ventral rami is forming the roots. Now, in this diagram itself, what you can appreciate, the C5 and C6 is joining. So, let me just... So, here you can see C5 and C6 will join to form the upper trunk of brachial plexus. C7 alone will form the middle trunk, and C8 and T1 will join to form the lower trunk. So, what is this? This is the trunks of brachial plexus. Now, I have also told you that if I talk about the brachial plexus, I have also told you that roots and the trunks are residing in the neck region, and after that each of the individual trunk of brachial plexus, that is upper, middle and lower, will divide into anterior and posterior division. So, next component is division of brachial plexus. And the division of brachial plexus is exactly located behind the clavicle. So, I am using blue color for the anterior. So, this is the anterior one, this is also anterior, this is also anterior. So, these are A for anterior. So, these are A for the anterior division. So, A stands here for the anterior division of the from the trunks of the brachial plexus, and we will use yellow color for the posterior division. So, this is P for posterior division, this is P for posterior division, this is P for the posterior division. So, each of the trunks of brachial plexus is dividing into anterior and posterior division. Now, in this diagram itself, if you will concentrate here, what you can see, the anterior division of upper, the anterior division of middle. So, this is the anterior division of upper, this is the anterior division of middle, will together join to form. So, this will together join to form the lateral cord of brachial plexus. So, what it is forming? It is forming the lateral cord of brachial plexus. Here itself, if you will see, the anterior division of the lower, will continue to form, it is continuing to form the medial cord of brachial plexus. So, that is also shown here. Now, if you will see in this diagram, you can appreciate that the posterior division, so this is the posterior, this is posterior and this is the posterior. The posterior division of all the 3 trunks will together join and will lead to the formation of posterior cord of brachial plexus. So, this concept, not only the branches of brachial plexus is important, that you should know the different branches of brachial plex component, but what is more needed is also that you should know about the formation of brachial plexus component. So, this is clear from this image, I think. Okay, let's come up with the brachial plexus topic again. So, again I just want to show you a schematic diagram where we can clearly see the roots, we can clearly see the trunks, we can see the division and the cords. And in this diagram, we are clear with the important branches of the cords of brachial plexus also. And here the same schematic diagram has been appreciated. So, roots has been shown, the trunks which is 3 in number. So, we have got upper, middle and the lower trunk. Then we have got anterior and posterior division, and we have got here the cords of brachial plexus. So here, if we will see this diagram, we can clearly appreciate in this diagram this posterior division of all the trunks is forming the posterior cord. So this is the posterior cord. Now here we have got this is the lateral cord, and this is the medial cord of brachial plexus. Medial cord will be formed from C8 and T1, and lateral cord from C5, C6 and C7, and the posterior cord as it is formed by the posterior division of all the three trunks, so it will include all these root values. Okay, so done with this. Now it is important to know the branches of brachial plexus. So exactly branches of brachial plexus, again I will come to this schematic diagram and help you to understand all the branches of brachial plexus. But before that, what I want that I would like to give you a story. I would like to tell you a story by which you will understand the parts of brachial plexus, components and its branches. So first thing is that if I talk about the root, so I just I want to slightly enlarge this image. So yes, if I have enlarged this image, so in this image, you can see the two important branches of the roots has been shown, LTN, long thoracic nerve, and DS. What do you mean by DS? Dorsal scapular nerve. So dorsal scapular nerve and that of long thoracic nerve, these are the two direct branch from the roots of brachial plexus. Other than that, it also gives contributing fibers to that of to the C5 component through the diaphragm, and it also gives innervation to other muscle, longus coeli and all. We will talk about that. Other than that, if we see the upper trunk, so exactly this is the UT, this is upper trunk, this is the middle trunk and this is the lower trunk. So only branches are given from the upper trunk. Here suprascapular nerve is always a branch from upper trunk, and nerve to subclavius is also a branch from upper trunk. Sometimes nerve to subclavius can also derive from the roots, but upper trunk is giving two branches as shown. Then no branches, so you can write no branches are given from the divisions. We have got anterior and posterior division. No branches are given from the division part of the brachial plexus, which is residing behind the clavicle. Thereafter, we'll talk about the branches of cords of brachial plexus. So firstly write this, then we will talk about the branches of cords of brachial plexus. So let's see the roots. So if I talk about the roots of brachial plexus, as in the diagram, I have already shown you the roots of brachial plexus branches. The two important direct branches is, so here actually nerve to subclavius has been written. So please don't get confused by this. I will just highlight this. Nerve to subclavius is here written as the branch of root. It is either branch from root or from UT, upper trunk of brachial plexus. So most commonly it is a branch from upper trunk of brachial plexus, but at times it can also be branch from nerve to subclavius. Okay. Now dorsal scapular nerve, long thoracic nerve, dorsal scapular nerve having the root value of C5, long thoracic nerve which is also called as Bell's nerve, or it is called as nerve to serratus anterior, nerve to serratus anterior. So Bell's nerve, nerve to serratus anterior, these are the branches which is from the root. Other unnamed branches as given branches to scalenus group of muscle, longus coeli, and also the branch given from the C5 root to the phrenic nerve. So these are unnamed branches. So we have done with this. Now let's see the branches from the upper trunk of brachial plexus. The good point is that there is no branches from the middle and the lower trunk of brachial plexus. So let's see branches from the upper trunk. So if I talk about the branches from the upper trunk, you can see two nerves are there, nerve to subclavius and that of suprascapular nerve. Suprascapular nerve is always the branch from upper trunk of brachial plexus, but nerve to subclavius can be sometime a branch from the roots of brachial plexus. No branches are given from the division. Now let's talk about the branches of lateral cord, medial cord and posterior cord. So we'll talk one by one. So firstly, I would like to tell, if we are talking about the branches from the lateral cord, let me slightly enlarge. So yes, if I am talking about the branches from the lateral cord, what I want you to explain that, let's take an example of one story. Okay, all of you are studying in your medical college and at times you want to apply for the leave, but sometimes what happens, you are not granted the leave because your reason is not very strong enough. But what happens if you ask for a medical leave and if you are ill, definitely you get the leave. So, one of your friend wanted to meet some special friend of his or her on. So, he or she has applied medical leave too. How many medical leaves? 2 medical leaves. So, branches of lateral cord can be memorized by the mnemonic medical leave too. So, please write down medical leave 2. In short, it is ML2. So, that means one branch name is from L and other 2 branches are from the L. So, we have got musculocutaneous nerve as the branch, we have got lateral pectoral nerve and we have got lateral root of median nerve. So, the 3 branches are given from the lateral cord of brachial plexus which can be memorized by the mnemonic ML2. That means medical leave 2, ML2 or medical leave 2. Here M stands for musculocutaneous nerve, L stands for lateral pectoral nerve and another L stands for the lateral root of median nerve. Now, after applying the for medical leave 2, what is the next is that you want to meet that special person. So, for that you want him or her to invite at your own place. And you are a very lazy person, you have not cleaned your room for a long duration of time, but you want that the special person should come to your home, so the whole environment is clean and the surroundings are clean. So, for that what you do, you did cleaning in your room and what you found? You found rats in the upper and the lower cell. So, if you have done cleaning after a long duration of time, you have found rats in the upper and the lower cell. So, the branches of the posterior cord can be memorized by the mnemonic rats in the upper and lower cell. So, write down RATS, rats. Where is the rats residing? The rats are residing in upper cell and the rats are residing in the lower cell. So, the rats are residing in the upper cell, the rats are residing in the lower cell. RATS is the mnemonic for it. Here R stands for, if I talk about R stands for radial nerve, A stands for axillary nerve, T for thoracodorsal nerve and another S, as I told you, upper and lower cell, that means upper subscapular nerve and the lower subscapular nerve. It's also important that you should know the root value of these nerves. So, upper, lower subscapular both is having C5 and C6 as the nerve root. Axillary nerve is having the root value C5, C6. Thoracodorsal nerve is having the root value of C6, C7 and C8. And the largest branch of brachial plexus, which is radial nerve, is formed by the ventral rami of C5, C6, C7, C8 and T1. So, all the branches of posterior cord can be memorized by the mnemonic rats in the upper and lower cell. After that, after the cleaning process being done, you want that special person or the special friend of yours to come to your place. So, when that special person comes at your place, you are telling him or her, me for you, mate for each other, like that, me for you. That means me for you. So, I am written for ki jagah 4 likha hai. So, that means 4M and 1U. What does that mean? That means 4M and 1U. So, your U stands for ulnar nerve, having the root value C8 and T1, and at times it also takes contribution from C7, which is giving innervation to flexor carpi ulnaris muscle. Now, 4M stands for medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm and medial root of median nerve. All these 4M, which is medial pectoral nerve, medial cutaneous nerve of arm and forearm and medial root of median nerve, is having the root value C8 and T1. So, done. So, by this small story, we are finished with all the branches of brachial plexus. Done? Now, my dear, so now let's solve few MCQs which has been asked in the previous year of examination for the NEET-PG and INI-CET examination. So let me read the MCQ for you. Which part of brachial plex is not giving any branches? So what is the question being asked? Which part of brachial plex is not giving any branch? The answer is division. So if I talk about anterior and posterior division, it is not giving any branch in the brachial plexus. Okay. Now here root of brachial plexus is giving branch, that is long thoracic nerve and the and dorsal scapular nerve. Upper trunk is giving branch, nerve to subclavius and suprascapular nerve. Cords is giving many branches as we have seen already. Now before proceeding to the next MCQ, I also want to show you all the branches in the schematic diagram. So come to that image. So let's come to that image. Okay, so I'm just enlarging this image. So I'm just enlarging this image. So once we enlarge this image, we can appreciate all the important branches which is shown here. Now let's concentrate first on the lateral cord of brachial plexus. So this is what? This is lateral cord, LC, lateral cord. This is RC, PC, that is the posterior cord, and MC, that is medial cord. So we have got 3 cords of brachial plexus. Here we have talking about the cords of brachial plexus. Now if I talk about lateral cord of brachial plexus, it is giving, so let's so if I talk about the lateral cord of brachial plexus, it is giving following branches. So it is giving musculocutaneous nerve. What is musculocutaneous nerve? A very important nerve giving innervation to the muscles of arm anterior aspect, that is BBC. Biceps brachii, brachialis and coracobrachialis. So these are innervated by musculocutaneous nerve. What about lateral pectoral nerve? Lateral pectoral nerve is the second branch from the lateral cord of brachial plexus, giving innervation to pectoralis major and pectoralis minor. Now, if you will see, the thickest nerve is the median nerve. So if you will see nicely this image, what you can see, this median nerve is thickest nerve, and let me slightly enlarge it. So when I am enlarging it, what you can see, there is lateral root of median nerve and there is also medial root of median nerve. So please don't include medial root of median nerve as a branch of lateral cord. That means 3 branches are from the lateral cord, and these 3 branches are musculocutaneous nerve, lateral pectoral nerve and lateral root of median nerve. Now this median nerve is a very peculiar nerve. Why it is very peculiar? Because it is formed from the 2 roots. So let's talk about the branches of medial cord. When I am talking of the branches of medial cord, we have got medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of median nerve and also the ulnar nerve. So these 5 branches are the branches from the medial cord of brachial plexus. Now talking about the branches from the posterior cord, so you can see it is written US, LS and T, and also the largest branch, that is the radial nerve and axillary nerve. So these all are again 5 branches from the posterior cord of brachial plexus. So you can just write here US stands for upper subscapular nerve, LS stands for lower subscapular nerve, and T stands for thoracodorsal nerve. And what about SS, NS? SS stands for suprascapular nerve, NS for nerve to subclavius and DS for dorsal scapular nerve. So we have done with this all the branches. And why I have shown you this image? Because at times the question can be asked in the form of image based question in which you have to identify the nerve. So done. If you are knowing the formation of the nerve, it becomes very easy to identify the branches of brachial plexus. So done with this. Now let's move on to the clinical anatomy. So before that, I would also like to solve another MCQ related to the topic of brachial plexus, root value of thoracodorsal nerve. If I talk about thoracodorsal nerve, the other name of thoracodorsal nerve is nerve to, it is also called as nerve to latissimus dorsi muscle. Nerve to latissimus dorsi muscle, and we know that latissimus dorsi muscle is contributing in the formation of posterior wall of axilla, which is having an action of adduction, medial rotation and extension, also called as climber muscle, and the root value is C6, C7 and C8. What is the root value? The root value of thoracodorsal nerve, an important branch from the posterior cord of brachial plexus, C6, C7 and C8. Now, I would also like to solve one more MCQs related to the previous year of NEET-PG and INI-CET examination, posterior cord of brachial plexus formation. So, you can see here they are not talking about or asking, the question is not concentrated on the branches, but it is concentrated on the formation of posterior cord. And as already explained you, the formation of posterior cord is via the posterior division of all the 3 trunks of the brachial plexus. So, the right answer is Dorsal cord of brachial plexus is formed by dorsal division. So, dorsal division of upper, middle and lower tongue. So, please don't confuse with the word dorsal. So, as we know, posterior cord is formed from posterior division of upper trunk, middle trunk and lower trunk. And the other word which is used for dorsal division is the posterior division. So, the right answer is D, dorsal division of upper, lower and middle trunks. Now comes the discussion of nerve injuries, the discussion of brachial plex injury. Two types of brachial plex injuries are common, that is the upper trunk of brachial plex injury and the lower trunk of brachial plex injury. Before that, I would like to explain Erb's point. What is Erb's point? Erb's point is the location of upper trunk of brachial plexus. So, Erb's point is located. So, Erb's points are located at the level of upper trunk of brachial plexus. Now, at the location of upper trunk of brachial plexus, as we know, upper trunk of brachial plexus is formed by nerve roots C5 and C6. So, that means C5, C6 and also we know two branches are given from the upper trunk of brachial plexus. So, this is C5, this is C6, which is the two, actually 6 nerves are meeting at the point of Erb's point, that is the location of upper trunk of brachial plexus, along with through branches subscapular, suprascapular and nerve to subclavius. And again, as I told you, upper trunk will divide into two divisions, that is anterior division and posterior division. So, in this diagram, you can clearly appreciate that the location of upper trunk of brachial plexus is the location where 6 nerves are meeting, and that 6 nerves meeting point is called as Erb's point. Now, there are two common types of injuries which is common in brachial plex injury. One is called as upper trunk brachial plex injury, the other is called as lower trunk brachial plex injury. Now, the cause of injury. So, firstly, I would like to talk about the reason or the cause of upper trunk brachial plex injury. So, if I am talking about upper trunk brachial plex injury reason, the reason is excessive increase in the angulation which takes place between head and the shoulder during birth injury or fall on shoulder. So, you can see if somebody is falling from a height and when he or she falls on a ground, he or she lands on the shoulder. So, that means there is excessive increase in the angulation between head and the shoulder leading to upper trunk brachial plex injury. The other is if excessive traction is applied while the vaginal deliveries, there is excessive stretching of angulation between the head and the shoulder. That is another reason in which upper trunk of brachial plex injuries can happen. Now, in the other side, you can also see in this image that in this image what you can appreciate that the person who is having the upper trunk brachial plex injury is having the position. So, you can see this is the position of arm and this is the position of forearm. FA means forearm. So, what you can appreciate, the arm is in adducted and medially rotated position and the forearm is extended and pronated position. So, it seems like someone is asking money from behind. So, the injury which is seen is also called as Erb's Duchenne paralysis. It is called as Erb's Duchenne paralysis. It is called as Erb's Duchenne paralysis, and in this condition, the arm is adducted, medially rotated, forearm is extended and pronated, and the nerve roots which is involved is C5 and C6. It is also called as waiter tip deformity or policeman tip deformity. Now, I would also like to show you another image. It can be either due to birth injury, it can be either due to the injury which has happened afterwards. If someone is falling from a height and landing on the ground by excessive stretching of the shoulders and the neck, or other can be a difficult vaginal delivery where the excessive traction is applied on the head. Now, what you can appreciate in this image you can appreciate the arm is hanging by the side and the arm is medially rotated and adducted. So, medially rotated and adducted, and if you will see, the elbow is extended, the elbows is extended and the forearm is pronated. The other name which is used for, so it is also called as policeman tip or waiter tip deformity, which is seen in the condition of upper trunk brachial plex injury. Now, let's talk about the lower trunk brachial plex injury. So, let's see the another image. When I am talking about lower trunk brachial plexus injury, what happens? In case of lower trunk brachial palsy, the site of injury is at the lower trunk. That is the nerve root which is involved as C8 and T1. Lower trunk injury, the nerve root which is involved is C8 and T1. Medial cord is involved along with ulnar nerve, and medial cutaneous nerve of arm and forearm is also involved. So, site of injury is lower trunk of brachial plexus. Injury happens to the medial cord of brachial plexus. Ulnar nerve, medial cutaneous nerve of arm and forearm is involved. Actually, the nerve root which is compressed is also shown. Here what happens, the normal reasons of the injury is either there is a cervical rib. What do you mean by the word cervical rib? Generally, we have got ribs in the thoracic cage. If there is an extra rib in the neck region or cervical region, it is called a cervical rib. When there is a presence of cervical rib, it can lead to the compression of lower cords of brachial plexus along with the subclavian vessels. Undue hyperabduction of arm leads to lower trunk brachial plexus injury or birth injury in the extended arm breech presentation. So, these are the three reasons where lower trunk of brachial plexus can be involved. So, you can see here the common mechanism of injury is, for example, if somebody is falling from a height and for saving himself or herself, he or she holds a branch of a tree, and that will lead to hyperabduction of arm. So, hyperabduction of arm or shoulder takes place and it leads to lower trunk brachial plexus injury. Also, breech in extended position delivery, and the resultant condition will be claw hand. To be more specific, in lower trunk brachial plexus injury or Klumpke's paralysis, there is medial claw hand. Which claw hand is pronounced? Medial claw hand. For complete claw hand, both ulnar and medial nerve has to be involved. So, this is an important feature which is seen in lower trunk brachial plexus injury. Now, other than that, I also want you to tell that we know that C8 and T1 nerve roots are involved. So, the other features which is evident in case of lower trunk brachial plexus, because of the contribution of T1 nerves which is having sympathetic fibers traversing, it will lead to the condition of Horner syndrome. It will lead to the condition of Horner syndrome. Okay, so the resulting features of Horner syndrome is it will lead to partial ptosis. Why partial ptosis? Because levator palpebris superioris is the muscle which is involved for the elevation of upper lid. Now, this levator palpebris superioris muscle in the upper eyelid is also having smooth muscle fibers which is innervated by T1 nerve roots which is carrying sympathetic innervation. So, that will lead to Horner syndrome. Meiosis, constriction of pupil. This is ptosis means drooping of eyelid. Meiosis means constriction of pupil, and hydrosis means absence of sweating, and anophthalmos means sunken eyeball. Sunken eyeball. So, the eyeball will be sunken, and you can see in this diagram, you can see the claw hand. What is this diagram showing? This diagram is showing the claw hand. What is it? It is claw hand. Now, claw hand which is pronounced, and a very important characteristic feature of lower trunk brachial plexus injury is that there is extension at the metacarpophalangeal joint, and there you can see the metacarpophalangeal joint. If you will enlarge this, you can see the metacarpophalangeal joint is extended, but the interphalangeal joints are flexed. Also, here in this baby, you can see there is drooping of upper eyelid, constriction of pupil, and sunken eyeball. So, this is showing the features of Horner syndrome. So, Horner syndrome is only present in lower trunk brachial plexus injury. Now, before proceeding to the next and solving the MCQs related in the previous year of examination, I just want everybody to concentrate on this comparison which is done in between the upper trunk brachial plexus injury and the lower trunk brachial plexus injury. Now, here one side the features. So, here this table is showing you the features or the structures involved of paralysis, that is the upper trunk brachial plexus injury, Klumpke's paralysis, that is lower trunk brachial plexus injury. As we have already told and we are already knowing that upper trunk is formed by the contribution from C5 and C6 nerve root. So, the nerve which will be involved in the case of upper trunk is C5 and C6. If I talk about Klumpke's paralysis, it will be involving C8 and T1. Klumpke's paralysis will be involving C8 and T1. Muscles paralyzed in the case of Erb's paralysis is mainly the part of deltoid, supraspinatus, infraspinatus. Extensor carpi radialis longus, brachioradialis, brachialis muscle. And mainly the muscle which is involved or paralyzed in case of C8 and T1, because the nerve root means that the ulnar nerve is involved, and primarily ulnar nerve is giving innervation to small intrinsic muscles of the hand. So that all will paralyze. Other than that, if I talk about the position of hand in case of upper trunk brachial plexus injury is policeman tip, porter tip or waiter tip deformity. The arm is lying by the side, hanging by the side of the body. It is medially rotated and adducted, and the forearm is extended and pronated. What about the Klumpke's paralysis, the lower trunk brachial plexus injury? As already explained to my dear students, as we know, C8 and T1 is involved, ulnar nerve is involved, which is giving innervation to the muscles of the hand, and because of involving these muscles of the hand, the feature is claw hand. It will be more pronounced in the medial side, so it is medial claw hand. What is the position of hand in the medial claw hand? So you can see the position of hand will be like this. The medial fingers in interphalangeal joints will be flexed, but at the metacarpophalangeal joint it will be extended. So this is the position of claw hand. Sensory laws along the so we know that sensory fibers. So we are knowing, like if I talk about axillary nerve, it is also giving sensory innervation in the arm region laterally. So that sensation will go on. If we talk about the sensory innervation along the medial side of forearm is from C8 and T1. So that sensation will be lost. Autonomic signs are absent in case of Erb's paralysis, upper trunk brachial plexus injury. But we have seen the sign and symptoms of Horner syndrome involved in lower trunk brachial plexus. So, it will be present in case of Klumpke's paralysis. Now, my dear students, let's solve an MCQ related to this topic of injury of brachial plexus. So, let me read it for you. Lower brachial plexus injury leads to Klumpke's paralysis, and the characteristic findings which will be seen in Klumpke's paralysis, the options are Horner syndrome, policeman tip hand, wrist drop, claw hand. So we have to choose the most appropriate and the correct answer. So actually the doubt is between the Horner syndrome and claw hand, because both are present in the lower trunk brachial plexus. But Horner syndrome is also present in other injuries. It is sympathetic innervation is involved, so it will be present. But claw hand is only present in the case of and it is more specific to upper trunk brachial plexus. So we will go with claw hand. Wrist drop is not the answer, because if there is a wrist drop, all the extensors of the forearm is gone, and it is mainly involving radial nerve. And we know that radial nerve will be involved only when the whole of the nerve C5, C6, C7, C8 and T1 is involved, because radial nerve is the largest branch of brachial plexus, which is formed from the posterior, which is a branch from posterior cord of brachial plexus. Policeman tip hand is not, because it will be seen in upper trunk brachial plexus injury. Horner syndrome is seen in lower trunk brachial plexus injury. It is another features which is associated with it. But if we have to choose most correct answer, we will definitely go with medial claw hand, which is always present in the case of Erb's, which is always present in the case of Klumpke's paralysis, not in Erb's Duchenne paralysis. Done. Now, I would also like to solve one more MCQs with you, that is related to NEET-PG INI-CET examination. So, this is a clinical question. Let me read it for you. This is also the question asked from the previous year of examination. A young boy who was driving motorcycle at a high speed collided with a tree and was thrown on the right shoulder. There was no fracture. His right arm was medially rotated and forearm was pronated. The following facts considering this patient is correct except. So here what happens in this case, if I talk about this condition, so definitely if I talk about this condition, the key features I want to highlight. So the key feature is about the cause of injury, mechanism of injury cause. So what you can see, he was thrown on right shoulder. So as I told you, one of the mechanism of injury for the upper trunk brachial plexus is somebody is falling right itself on the shoulder. So that will lead to the injury of upper trunk or brachial plexus. So now it is clear that this is a case of upper trunk brachial plexus injury. Also, the policeman tip deformity or waiter tip deformity, porter tip deformity. Here, the another key feature which has been highlighted here, as you can see, the arm and forearm position is there. There is no fracture, but his right arm is medially rotated and the forearm is pronated. So we know that in upper trunk brachial plexus injury, obstructive paralysis, there is medial rotation and adduction of arm, and the forearm, extended elbow and forearm is pronated. So this is definitely a case of upper trunk brachial plexus injury. Now the injury is occurring at Erb's point, that is C5 and C6 nerve root. So this is correct statement. A lesion of C5 and C6 is also correct statement. Supraspinatus, infraspinatus and subclavius biceps brachii is paralyzed. This is also correct because we know that suprascapular nerve gives innervation to that of supraspinatus and infraspinatus, and they have having the root value of C5, C6. Nerve to subclavius is also having the root value C5, C6. Biceps brachii is also innervated by musculocutaneous nerve, that is also contributing by the nerve of C5, C6. So definitely the right answer is median nerve and ulnar nerve. Why median nerve and ulnar nerve is the right answer? Because ulnar nerve will be involved in Klumpke's paralysis and lower trunk brachial plexus. So definitely, and we know that medial nerve as together is formed by medial root and lateral cord, which is a branch from both medial cord and lateral cord of brachial plexus. So the odd man out, and which will be not involved in the case of upper trunk palsy or obstructive paralysis, is C option. I hope it is clear to you. So after having a discussion of formation of brachial plexus, you are quite clear about the branches. You are knowing about the parts of brachial plexus, which is supraclavicular, which is infraclavicular, the branch from the roots, the branch from the trunks, the formation of the trunks, the formation of cords of brachial plexus. You are also knowing the branches from each component. A story has been told to you. You are knowing the branches from the lateral cord is medical leave 2, the branches from medial cord is me for you, and the branches from posterior cord is rats in the upper and the lower self. So we have done about all the features and mechanism of injury involved in upper trunk and lower trunk brachial plexus. All the best and keep studying. We will meet in the next session. Thank you so much.